Hey guys, October is here and the pink month where you and I create awareness against the second most leading cause of death in women, that is breast cancer. On today's episode of Health Talk with Fiifi, we are delving into breast cancer, looking at causes, types of breast cancer, symptoms and signs of breast cancer. We are looking at some preventable measures against breast cancer and some treatments of breast cancer. So come with me, let's dive into breast cancer and also create awareness against this disease. My name is Aja Duma Ansa, and kindly subscribe, like, comment and share this video to your family and friends, and also connect with us on all social media platforms at Health Talk with Fiifi. Now let's get into today's video. Breast cancer is a malignant tumor that develops from the breast cells. It is one of the most common cancers affecting women globally. Although men can also develop breast cancer, the disease typically begins in the cells of the lobules, that is the milk-producing glands, or the ducts, the passages that drain milk to the nipple. So while most breast cancers are identified in women, male breast cancer is rare, but it is possible. Now, breast cancer comes in various forms or types. Now, let's consider some types of breast cancer. So, there is ductal carcinoma in situ, DCIS. There is invasive ductal carcinoma, IDC. There is invasive lobular carcinoma, ILC. And there is triple negative breast cancer, TNBC. Now, let's take the very first one, ductal carcinoma in situ. So this is a non-invasive cancer where the cancer cells are confined within the milk duct and they have not spread to the surrounding breast tissue. If untreated, it can develop into invasive breast cancer. Also, invasive ductal carcinoma. This is the most common type of breast cancer. So it starts in the duct but invades surrounding tissues in the breast. And over time, it can metastasize to other parts of the body. So this type of cancer starts in the duct, but invades surrounding tissues, and as time goes on, spreads to other parts of the body. There is also invasive lobular carcinoma, ILC. So this cancer starts in the lobules and spreads to the nearby breast tissues. Like IDC, that is the invasive ductal carcinoma, it can also metastasize to other parts of the body. So like the IDC, that is the second invasive ductal carcinoma, invasive lobular carcinoma can also metastasize to other parts of the body. Other forms of breast cancer include human epidermal growth factor 2 positive breast cancer, HER2 positive breast cancer. So with this type of breast cancer, it has an overexpression of the HER2 gene, which promotes cancer cell growth. So with this, targeted therapies such as Herceptin are most often used to treat this form of breast cancer. There is also inflammatory breast cancer, IBC. This is a rare and aggressive form of breast cancer, where cancer cells block lymph vessels in the skin. Cancer cells block the lymph vessels in the skin, leading to swollen, red, and inflamed breasts. It then progresses rapidly and requires immediate treatment. Also, there is Paget's disease of the nipple. Paget's disease of the nipple. This form of breast cancer is rare, but this form of breast cancer also begins in the duct and spreads to the skin of the nipple and the areola. Symptoms may include crusting, redness, or irritation of the nipple. There is also metastatic breast cancer stage 4. So with this breast cancer, it means it has spread to other parts of the body, such as the bones, the lungs, the liver, or the brain. So it is considered the most advanced stage and it's not curable, but treatment can help manage symptoms and also extend life. Now let's consider some risk factors of breast cancer. So several risk factors can increase the likelihood of developing breast cancer, which includes genetic factors. So mutations in the BRCA1 and the BRCA2 genes significantly raise the risk of breast cancer. Women with a family history of breast or ovarian cancer, they are also at a higher risk of having breast cancer. Age. The risk of breast cancer increases with age. with most diagnoses occurring in women over 50 years. There is also hormonal factors such as extended exposure to estrogen, either through early menstruation before age 12 or late menopause at age 55, or hormone replacement therapy (HRT). All these can increase breast cancer risks. There is also reproductive history. Women who have never been pregnant, had their first child at 30, or did not breastfeed may have a higher risk of developing breast cancer. I repeat the reproductive history. Women who have never been pregnant, women who have had their first child after 30, or did not breastfeed may have a higher risk of developing breast cancer. There is also lifestyle factors. Poor diet, lack of exercise, alcohol consumption, and obesity, particularly after menopause, can raise the risk of breast cancer. There is radiation exposure. Women who have undergone radiation therapy to the chest for other cancers, especially at their younger age, are also at higher risk of having breast cancer. Dense breast tissue. Women with dense breasts, more fibrous and glandular tissues, and less fatty tissue, they also have increased risk of developing breast cancer, as it may also make it harder to detect cancer on mammograms. Breast cancer symptoms may vary widely and may include a lump or a mass in the breast, which is most often painless. There could be swelling of part or all of the breast, skin irritation or dimpling, resembling an orange peel, breast or nipple pain. There is nipple retraction, that is the nipple turning inward, redness or scaling, or even thickening of the nipple or the breast skin. Unusual nipple discharge, sometimes bloody, can also show that there is cancer cells growing. So it is very important to know that these symptoms do not always mean breast cancer is present, but any changes should be reported to any healthcare facility for a healthcare provider to attend and examine a person's breast. Now, upon all these symptoms mentioned, how can we diagnose one of breast cancer? So the very first thing is breast examination. A doctor manually checks for lumps or other abnormalities in the breast. Mammogram. So an x-ray of the breast can be done. Mammograms can often detect the tumors before they can be felt. There could be ultrasound as well, where sound waves are used to produce images of structures within the breast, helping to determine if a lump is solid or filled with a fluid or fluids. Magnetic resonance imaging, that is MRI. So there could be breast MRI, which may be used for women with high risk of breast cancer, or to further evaluate any abnormal mammogram or ultrasound results. And the last thing is biopsy. A small sample of the breast tissue is removed and examined under the microscope to confirm the presence of cancer cells and also determine the type of breast cancer. The treatment plan for breast cancer depends on the type, the stage, and the individual patient factors. That may include one or combination of the following treatment plan I'm about to mention. So depending on the stage, the type, and the factors, individual may be advised to undergo either two or one of these plans I'm about to mention. The first one is lumpectomy. So the lumpectomy, removal of the tumor and a small margin of surrounding tissue. Mastectomy, removal of one or both breasts, partially or completely. There is also lymph node removal. Nearby lymph nodes may be removed to check for the spread of cancer. Radiation therapy. High energy rays are used to destroy cancer cells, often after surgery to kill any remaining cells. Now, breast cancer survival rates have improved dramatically, especially when detected early. According to the American Cancer Society, the 5-year survival rate for localized breast, that is localized breast cancer, that is cancer that has not spread, is about 99%, and it is so incredible. But the survival rate decreases as the cancer spreads to nearby tissue or distant organs. Now let's consider some prevention measures and early detection. So regular screening. Mammograms are the best method for early detection. So women aged 40 and older should undergo routine mammography every 1 to 2 years, depending on individuals' risk factors. Lifestyle modifications. So maintaining a healthy weight, reducing alcohol intake, exercising regularly, and avoiding smoking can reduce the risk of breast cancer. There is also genetic testing. Women with a family history of breast cancer may benefit from genetic counseling and testing for the BRCA1 and 2 mutation. Preventive surgery. Some women at high risk, especially those with genetic mutations, opt for prophylactic mastectomy or oophorectomy, that is the removal of the ovaries, to reduce cancer risks. Breast cancer remains a significant health challenge worldwide, but advances in screening, treatment, and awareness have led to earlier detection and more effective treatment. Ongoing research continues to improve outcomes and offer hope for a cure. Regular screening and being aware of the symptoms are critical steps for early detection and successful treatment. So I would urge each and everyone to go get their breast checked. Those above 40 should take it upon them to go for mammogram every 1 to 2 years, and also go for checkups as well. If you notice any symptoms, any challenge, or any abnormal discharge coming out from your breast, do so to visit the nearest health facility. With you and I, our voices, we can create awareness against this cancer, which is affecting most women and killing most women worldwide. Let's all do so to create awareness against breast cancer and make sure we get our breast checked this October. Visit any nearest health facility and go get your breast checked for free. This has been Health Talk with Fiifi. My name is Adjoa Duma Ansan. Kindly subscribe and like, and also follow us on all socials to get interactive with us. See you same time next week. Bye.